There's a silent disease spreading among us. Its name is chlamydia. Could you or someone you love have it? We're all sexual beings. It's the nature of our species. It's because of this that we are all at risk for getting this STD. Being informed can only help us all stay protected. As a nurse, I have seen some of the long-term effects untreated chlamydia can have on its victims. I've done research on this disease. I've spoke with a physician who treats people with this disease, and I'm dedicated to informing others who may be affected by this disease. Chlamydia, according to UpToDate, is the most common sexually transmitted disease in the United States today. It's often without symptoms, leaving us unaware of any infections we may have. Left untreated, this disease can cause serious long-term problems for women and in rare cases, men as well. I'm here tonight to talk to you a little bit about chlamydia. I want you to learn what and how common chlamydia actually is, along with its symptoms, treatment, complications when left untreated, and how we can protect ourselves against this STD. First, we will talk a little bit about how common this disease actually is and what makes it so common. How common is chlamydia? What makes it so common? According to the Centers for Disease Control, chlamydia, a bacterial infection caused by the bacterium Chlamydia trachomatis, is the most commonly reported STD in the United States today. There are approximately 4 million new cases every year. In North Dakota alone, the latest statistics from 2008 tell us that 1 in every 350 people report having this disease. In a recent article written by Lois McGuire, nurse practitioner at the Mayo Clinic Women's Health Center, chlamydia rates have risen 7.5% from 2006 to 2007 alone, and that number of total cases may be even higher, as people are often unaware that they have the infection and they're not being tested. WebMD informs us that chlamydia is so common because it often causes no symptoms. Because of no symptoms to alert us, it's easily spread from one sexual partner to another. In fact, 75% of all infected women and 50% of all infected men are without any symptoms at all. It's not always easy to tell if you're infected. Symptoms may not always be present. But if there are symptoms, there are some common symptoms to be aware of. So let's go over some of these symptoms. According to GetSTDtested.com, symptoms of chlamydia usually start about 1 to 3 weeks after being infected. Let's now look at some of these common symptoms seen in men. First common symptom is clear or cloudy discharge from the tip of the penis, burning with urination, burning and itching at the top of the penis, and pain and swelling in the testicles, although this is more rare. In women, some of the common symptoms are abnormal discharge from the vagina, burning with urination, low back pain, low abdominal pain, painful intercourse, and bleeding between periods. It's important to know that if you have any of these symptoms, you should see your doctor and get tested. It's as easy as taking this culture swab that I have here, swabbing the vagina or cervix in women, or the tip of the penis of men. Or you may need to give a urine sample in a cup just like this. Treatment may be needed. According to the CDC, if chlamydia goes untreated, this infection can progress into serious, usually irreversible, lifelong complications for both men and women. Complications, although rare in men, include infection of the epididymis. This is the tube that carries sperm to the testes. Arthritis, often are called Reiter's syndrome, which can cause sores on the hand, swelling of the penis, conjunctivitis of the eye, and even sterility. In women, some complications include PID, which is referred to as pelvic inflammatory disease, chronic pelvic pain, damage to the fallopian tubes due to the infection, ectopic pregnancy, which is a pregnancy outside of the uterus because the reproductive organs become infected, infertility, and, if exposed, an increased risk of HIV. These pictures here show some of the complications of untreated chlamydia. As you see, this is Reiter's syndrome, chlamydia conjunctivitis of the eye, Reiter's syndrome that presents in the penis, Reiter's syndrome that presents as a rash on the bottom of the feet, chlamydia on the tongue, Reiter syndrome on the hands, and chlamydia, the watery discharge from the tip of the penis. Let's now end with some ways that we can protect ourselves. To protect the spread of chlamydia, Dr. Kushik Bunya, a local internist, recommends the following methods to keep all of us protected. The number one most effective way to remain chlamydia-free is abstinence. This is not always realistic, and so therefore having monogamous sex is a must. Must use a latex condom with all sexual activity, and it's important to note that there's a 2% failure rate with this method. Treat not only yourself but your sexual partners as well, and this includes all sexual partners from the last 60 days for sure. Treatment is as easy as taking one antibiotic pill. It needs to be an antibiotic because this is a bacterial infection, and absolutely no sexual activity until all treatment is completed. Chlamydia, the most common STD, easily spread and is on the rise. Left untreated can cause serious, often irreversible complications. It's important to remember this bacterial infection is not only common, but continues to spread. Let's review. Most often, it's without symptoms, but if symptoms are present, they include abnormal discharge from the vagina or from the penis, burning with urination, pain and swelling in the genitals, abdominal and back pain. If left untreated, there's serious complications. Infection of the reproductive organs, Reiter syndrome like we talked about, chronic pelvic pain, sterility, and even an increased chance of HIV. Testing and treatment are simple. The most effective form of protection is abstinence, but monogamous sex is essential along with the use of a latex condom. Complete all treatment. Well, now that you know a little bit about chlamydia and how to stay protected, keep gloving and loving and get tested. Thanks for coming.